there's many things. I mean, we see that too with our mobile food distributions, the variety of living situations and life experiences and things that are shared with us when we're at our mobile food distributions. But I would guess, much like your staff, we get a lot of gratitude from people who are visiting our program and who are receiving food from us. And I just think that's what fills your cup, right? I mean, that's when you know that you're driven to do good, and today you impacted somebody. Welcome back to 50 Faces of Feeding South Dakota. We're glad you joined us for our podcast, where every week we're hosting conversation with somebody who has been a part of Feeding South Dakota's 50 years of history or part of the future of Feeding South Dakota. Today, we're from our Pierre Distribution Center, and we're here with Scott Jones to have some conversations. Scott, thanks for joining us.
My pleasure.
So we're here at the Pierre Distribution Center and acknowledging 50 years of Feeding South Dakota in the state. But Pierre was the last location that Feeding South Dakota opened a distribution center. And I understand you were part of that work. Can you tell us a little bit about that?
Yeah, I think in 2009, the mayor of Pierre then, Lori Gill, was approached by Walmart saying, we put a lot of food in the Pierre landfill, and it sure would be nice if we could find a way to get that into the hands of needy people. People could use the food. And so the mayor created a task force to look into ways to capture that food and put it to good use. So she had a committee in place, and about that time, Feeding South Dakota became aware of those conversations and said, we've thought for a long time we needed a Central South Dakota distribution center. If Pierre can come up with a building, we'll operate the food bank.
All right.
And it seemed like an ideal situation because it was going to be a highly competent organization that already had the model and the connections to turn food into or food opportunities and leverage dollars and donations. And so that left the local committee with trying to find a facility that would work and raising the funds for it. They identified that the Pepsi-Cola bottling plant at the time was available for sale and that it was going to cost a little over $600,000 to buy the building. And so the local committee started working on that. Well, I wasn't part of that committee, but I happened to be in Gregory at a Bank West board meeting. And on the way back, Bob Miller, who worked at Bank West and was a member of that committee, said, wow, we really need some help to get this thing going. We can't raise $600,000 doing spaghetti dinners and chili feeds. We're going to need some fairly serious donations. Well, the more I got to thinking about it, Delta Dental of South Dakota since 2004 has been operating a mobile dental program. We started with one in 2004 and added a second one in 2008. And one of the things we often heard from our people in the mobile dental clinic was how many kids came to the truck hungry and wanting to know if we had any food we could share with them. So we already had kind of a heightened awareness that there was a lot of need for additional food out in the communities that we were serving. And then as we got to thinking about our foundation's mission, which is improving oral health, good nutrition's an integral part of good oral health as well as good overall health. And so I talked to my board about potentially being the lead donors in acquiring that facility. and they agreed to a $300,000 donation.
That's incredible.
Yeah. In the meantime, Bank West had always been a local leader in almost every kind of charitable event that happens, every building project. But Charles Burke II, in particular, had an interest in feeding people. Often, if they were having a Christmas party at their home, they would say, bring food items.
Oh, like a food
share
like
it with
food
the
drive.
local food pantry,
Yeah.
food drive. And when he passed away, his children decided that in his memory, they would like to honor that tradition with a major gift to Feeding South Dakota. And so between the bank and the Burke children, another $150,000 came in, and between those two gifts and other gifts from others within the community, we were able to get the Pepsi building purchased. Feeding South Dakota started its work in about 2010. And then a few years later, as the legislature approved the mobile distribution program, or at least made that opportunity available to Feeding South Dakota, it became obvious that we're going to need a much bigger facility if we're going to operate a mobile food pantry, or mobile food distribution.
And that is how we came to be in the building we're in today.
Yes.
Which, out of the 3 distribution centers that Feeding South Dakota has, it's the smallest distribution center, but mighty. I mean, serving the whole central part of the state through our mobile food distribution program and our agency partners and our child hunger programs, and really has been essential to helping us cover all 66 counties in the state.
Yeah.
So I want to go back to something you said about, oh gosh, I'm trying to think. You said it and I was, the cost of the building, $600,000. That seems kind of incredible in today's real estate market. It almost feels like a deal.
Well, at the time it was. The Pepsi distribution center, or the Pepsi bottling plant, was empty and available, and they were looking for a buyer. It was kind of well worn, but it had characteristics that would work for food distribution, and so it was a great way to get started. And about that time, Feeding South Dakota had only recently become a statewide organization. There was the East River and the West River that kind of came together. And I think it took a little while before Feeding South Dakota was willing to embrace large fundraising efforts. The model was pretty much, you pay us X amount per pound of food to cover our transportation costs. We'll work with our major donors of food supplies, and together we'll get that food to people who need it. And so at the time, the Rapid City Food Bank was in an old grocery store. The ceilings were way too low. There were a lot of challenges with that building. The mobile distribution program had made the Pierre facility way too small, and Sioux Falls had things that it needed to do to expand and to change. All at once. And so the board moved outside its comfort zone and embraced a $6 million project to do a new facility in Rapid City, followed by a new facility in Pierre, followed by what was originally going to be a renovation of the Sioux Falls facility, but later on evolved into a brand new food bank in Sioux Falls as well.
And relocating from the Pepsi building to where we're at now out here on Grace Avenue as a food bank was really beneficial for us because of the amount of trucks, the food coming in and the food going out. We've got great access to the highway and that type of stuff. But what was so I want to go way back to when the mayor starts this this committee to determine is this a need. What was food access like, or what was food insecurity like in this area at that time? I mean, you mentioned kids coming to the mobile dental clinics hungry, but were there other indicators of the need for food access?
There had been a food pantry that was operated by the Fort Pierre Ministerium,
Sure.
the Ministerial Association. In fact, they led to the founding of Pierre Area Referral Service. Yes. And Pierre Area Referral Service has operated the pantry in Pierre forever.
And they're a partner of Feeding South, so they get a lot of food from us.
They're a partner of Feeding South Dakota, but there really wasn't a great way for PARs to capture food from retailers that had food that was expiring, or especially from the major manufacturers or distributors nationwide. And so to become a partner agency, I think, has really helped both organizations.
Yeah, because as a food bank, that's our area of expertise. And especially as a member of Feeding America, having access to those national donations from Kellogg's or General Mills, but also just understanding the logistics and the safety needed to move food around the state. And so that is a great thing about those 250 plus agency partners that work with us, is that is taken off of their shoulders so that they can do what they do well, which is direct service to people facing hunger. So that was, I'm sure, a bit of a relief and a good move for PARs, because they gained food access a little bit easier.
Yes.
So tell me, what is your connection to Delta Dental? You mentioned that you went to Delta Dental to talk about sponsoring a part of the building buy. What's your connection there?
Well, I started at Delta Dental in March of 1977. At that time, I was employee number 3.
All right.
We had almost no business and even less money. But over time, more and more employers started adding dental benefits for their employees. As the company grew and added more business, we started putting a little bit of money back into supporting our communities. And the game changer for us was in 1996, we became the administrator of the South Dakota Medicaid dental program. And that kind of opened our eyes to a whole world of unmet need that we'd not been.
Sure. It's a whole different audience of people.
Yes. And so we created the Delta Dental of South Dakota Foundation at that time and started putting significantly more money toward things to improve the dental workforce, access to care, and to try to reduce the disease burden through prevention and education. And one of the programs that we implemented then in 2004 was the Ronald McDonald Care Mobile. And within a year, we had a waiting list of communities that wanted us to come. And so when the state approached us and said, if we could come up with the money for a second truck, would you operate 2? We knew the need was there, so we added a second mobile unit. And for the last 20 years, our mobile staff has been living out of suitcases and motel rooms 40 plus weeks a year, taking care of kids. And we've now seen almost 60,000 kids over that period of time, many of whom would just break your heart with the stories. I remember Carrie Mekinen, who operated and managed our program from inception until her retirement, talked about being in Sioux Falls one day, and one of the kids who'd come there said, I'm really hungry, do you have anything to eat? And so they got him an apple, and as he was finishing up his apple, he had the core left, And Carrie grabbed a garbage can and handed it over to him. And he said, no, put it in his pocket and said, I'm saving this for later.
Wow.
And stories like that just.
Yeah, because I often equate, we talk about food insecurity. We use the words food insecurity and hunger almost interchangeably when we talk. But hunger is different from food insecurity. Hunger is a physical feeling. Your stomach growls. We've all been hungry. But the difference is when you're food insecure, you can't just go to the cupboard or the refrigerator and have the food you need to fulfill that. Where if you're hungry, many people can do that. And so same as I've interacted with neighbors who utilize our programs, you start to understand how important every little bit of food is to these people who don't have that regular access, whether they can't afford it or the grocery store isn't in their community and they don't have the dollars to travel. They make use of everything. And it is, you start to understand and take for granted. I mean, I drive by 3 grocery stores on my way to and from work every single day. And I've been in many South Dakota communities that are so rural that the nearest grocery store is 60 miles away. And that's a small town grocery store, let alone getting to a box store or a Walmart or, a place that you can buy a greater amount of groceries at a lesser cost.
Yeah.
So your mobile dental program is a lot like our mobile food distribution. I mean, the model is sort of the same. Tell me how that concept came to be, that going to communities.
Well, there are large parts of South Dakota that don't have dentists. In fact, we said to some of our colleagues in other parts of the country that don't understand how remote this part of the country is. That's a real
thing, isn't it?
That we could drop a landmass the size of Massachusetts in northwest South Dakota and not hit a dentist.
Right.
And so if people live 100 miles from the nearest dentist, and if their family is challenged with reliable transportation or the ability to get away from work or has no source of payment, the only way that those kids are going to receive care is if someone comes to them. And so we work with local community site partners. So it might be the local school district, it could be a Boys and Girls Club in Rapid City Youth and Family Services that I know is one of your partners.
Yep.
They invite us to come to spend a week to take care of their kids. There's a site sponsor that puts some of the money. It costs $20,000 a week for our mobile unit to be in a location. We ask our site partners to put in $3,000, partly so that they've got some skin in the game.
Yeah, and make sure that people are going to come. And yes, absolutely.
But partly also because it costs so much more than we collect Medicaid or sliding, or not sliding scale, but Medicaid or private insurance where it's available. But typically that brings in, between the site partner fee and the insurance payments, we collect about half of what it costs to be there. And then Delta Dental's foundation makes up the difference.
So I'm thinking about your dentists and the team that are in your mobile units. You mentioned the child with the apple in their pocket and the fact that kids come and talk about how they're hungry. I imagine that those team members need a different level of training in order to be effective in this position. Is there a special training program, or is there anything additional that you equip them with so that when they're interacting with these families and these kids that may need additional resources or are living differently than they are, they're equipped for that?
I think one of the things we found is that it takes a special kind of person to even want to take one of those jobs, because it's one thing to be delivering care, to be a dental assistant or a dental hygienist or a dentist, but to take it a step further and say, on Monday morning, we'll meet, we'll make sure everything's loaded and ready to go in the truck. We'll then travel 200 miles to where we're going to spend the week. We'll take care, we'll do exams the first day, identify the treatment plans of the kids. We'll take care of them over the course of the week. And at the end of the week, we'll come home and spend the weekends with our families. It takes somebody who really has a heart for kids to begin with. And so I don't know that we've had to do, there's always some training, but I think the people who self-identify as that's something I want to do for those kids are already 3/4 of the way there.
That compassion is inherent. It's there.
Yes.
They want to help in more ways than just providing dental services, and they're ready for whatever comes their way through that truck. And I'm sure there's many things. I mean, we see that too with our mobile food distributions, the variety of living situations and life experiences and things that are shared with us when we're at our mobile food distributions. But I would guess, much like your staff, we get a lot of gratitude from people who are visiting our program and who are receiving food from us. And I just think that's what fills your cup, right? I mean, that's when you know that you're driven to do good, and today you impacted somebody. And we've talked a lot lately at Feeding South Dakota about how our team that drives our trucks, our Class B trucks that go out into communities for these mobiles, you can't hire just truck drivers. You have to hire people who understand that they are the connection to the community of Feeding South Dakota. They're the ones directly interacting with the volunteers who are loading the food. They're directly interacting with the guests and the neighbors who come. And so it takes that special person. And that's one of the things I love about our work is that everybody is passionate about what we do. They all are invested in the mission wholeheartedly. So with that in mind, tell me about how Delta Dental initially, you talked about the correlation between healthy eating and nutrition and good dental care and overall health. But that is that investment in that food bank, that desire to drive that forward is a little bit of a jump from dental. So what is it that makes it so important for that connection to be there?
Well, as a South Dakota company that's not only a nonprofit, but also dedicated to the mission of improving oral health and overall health for not only the customers that buy Delta Dental coverage, but for all South Dakotans, we try to look at innovative ways that we can initiate or collaborate or support things that are going to help advance that mission. And so if there's somebody, we're kind of an odd nonprofit in that sometimes we do fundraising events to see if there are funding partners that are willing to help join us in some of the work we do, some of the programs that cost quite a bit of money to keep in place. But we also recognize there are a lot of other people out there doing really good work. And so we also operate a grants program to help get money to them, because often oral health needs aren't high on people's radar. And so we may have one hand out encouraging and welcoming gifts to us, but on the other hand, we have our hand out handing money to people who are doing good work that we can support.
And that's important. I mean, back to the agency partners, we talk a lot about how they are the ones doing the work in their communities. And to your point, that's the more we can equip those agency partners for success, the more services they can provide, the more people who have food access. And so that's a really interesting correlation. And I love how you said as a South Dakota company, because as a statewide organization, it really does take that community support and everybody coming together to make change. And we often see that likely if somebody is in line for our food, they also may need help with rent or utilities or medical care. And so we also may provide additional resources or information on how to get to the helpline center who can help with additional resources, because the better we can serve individuals and help meet their needs, the healthier communities are and the stronger the state is.
Yep.
And I think that's a really important message around that, right? What is the term? 6 degrees of separation. Like if you really sit with somebody and talk about who you know, at some point you have a common connection. And in the mission of fighting hunger that Feeding South Dakota is in, I think we can draw that correlation to almost any organization or nonprofit in the state, because food is a basic need. It's you need to be able to not worry where your next meal is going to come from in order to focus on the next thing. And you need nutritious food in order to mitigate chronic disease or, all the holistic well-being. And so it's really easy for us to kind of correlate that and understand that the work we're doing is making an impact even beyond filling people's tables with food. So what Feeding South Dakota has been in Pierre for several years now. And we're acknowledging 50 years in the state, and we're heading into the future of the work that we do. What do you envision for Feeding South Dakota? What do you think would be, a mission to end hunger is a big mission. It's a lot because there's so many things that impact that. But as you think about Pierre and the central part of the state and the work that is done by Feeding South Dakota out of this distribution center, what do you think the future is of accomplishing that mission?
Well, I think Feeding South Dakota has done a really good job of creating more awareness. And I think Feeding South Dakota has become a very trusted partner for people who are interested in being part of the solution. My wife, Julia, is the chair of the Pierre Referral Service Board, PARS.
6 degrees of separation. See, there you go.
Yeah, the rest of the world operates in 6 degrees of separation. In South Dakota, it's 1 or 2.
2, yeah.
It doesn't take long to start making connections here. But PARS, like I'm sure many of your hundreds of partners, struggles with its finances and with its ability to deliver on its mission. And so the fact that Feeding South Dakota has developed this support network and this capacity to help bring some of the money and some of the solutions to the table, I think the next step, or what I hope will be the next step, is Feeding South Dakota helping its hundreds of partners to do their jobs better.
Yeah.
That if Pierre Referral is going to operate the pantry and do the backpack program and do nutrition boxes and going to help with all of the other things, and it's struggling to keep the doors open and staffed, the more that Feeding South Dakota can make it easy to acquire food and to acquire the other things that help make the program work effectively, the better off we're all going to be. Because for Feeding South Dakota, PARS is that boots on the ground, peer area partner that knows the community well, that can take care of the individual family needing assistance. Whereas Feeding South Dakota is geared more to say, we'll go talk to General Mills and we'll go talk to Kellogg's and we'll bring in large amounts of food and we'll handle the logistics of getting you more for less than could be imagined. But we need you locally to help connect us to the people who are the end users.
Yeah, and I think that when we think about even just the last 5 to 6 years in the nation, the transition that's happened economically, where we had a worldwide pandemic, and the way that Feeding South Dakota operates shifted from that logistical, we can get food where it needs to be, to agency partners couldn't open in communities for safety reasons. And that's how our mobile food distribution really just expanded across the whole state. And we're still operating in that model. But what it doesn't do is create great hours of access for people who need food. We're in a community for an hour once a month. And if you have to work, just like your dental clinics, if you have to work, or if you don't have the transportation to get there, or some people are in line for those mobiles for hours. And if that's not something you can do, you've lost the only food access that you have in that community. And so communities know what they need. And that, I think that's a really great vision, that transition back to community leading that solution, and Feeding South Dakota being the support mechanism for that. Because the feasibility of Feeding South Dakota in every community just isn't a reality in a way that is effective for people facing hunger. And I think as we see, continue to grow as a state, we see many people moving toward urban areas, and many larger organizations coming into urban areas, and that's where the employment's available. While in smaller communities, grocery stores are closing, employers are closing. But at the same time, we have an aging population that is managing food pantries without transition plans. And so that runs a risk of things closing, and such as PARs, even just employing people as a nonprofit has become a challenge. So I think that seems like a really great fit for Feeding South Dakota to be an initiator of keeping that success going right in those communities.
Yeah, if you think back to when the two organizations got together 20 years ago, it's a remarkable evolution to the organization today, which has built capacity in terms of not only relationships with the people that can get you the food and the logistics and all of those things, but also the donor community, and saying there's a great role for you in helping us solve this together with our partners.
And also helping people understand that the face of hunger isn't what people think it is always. It is families in rural communities, or families that have both parents working. I mean, there are so many different challenges to food insecurity that I think it's just really important for people to understand. We may have somebody utilizing our program or our agency partner for only a few months because there's just been a little blip in their financial situation. And we may have people utilizing it for longer for one reason or another. Maybe it is a disability that prevents them from working, or lack of transportation that prevents them from getting to the next community. But regardless, everybody deserves food. Everybody, should have that ability to not have that hunger. And we don't need kids or adults going to bed with that sensation of hunger and trying to think through what's the next day look like. And that's one of the reasons I'm so passionate about the work that we do, is because I really feel like if we can solve this, if we can meet those social determinants of health and those root causes, the work Feeding South Dakota is doing is meeting the need now. But as those solutions come into place, hopefully there's not a need for Feeding South Dakota in 50 more years, because we've accomplished our mission of ending hunger. Do you think that's too big and bold of a vision?
I think
it's not a trick question.
No, I think you aspire for big visions and big dreams, and if you shoot for the moon, even if you don't hit it, you'll probably accomplish a lot more than if you simply say, I think we're doing all we can do. I think back to when the Feeding South Dakota board decided to embrace the $6 million campaign to do Rapid City, Pierre, and Sioux Falls. Probably the best thing that did and could have happened in that was Dale Larson agreeing to chair it and making incredible gifts toward the success of that campaign. And so I think the success of that campaign kind of emboldened the board and the leadership to say, wow, we did that. I bet we could do the next big thing too. And I know there's been a major feasibility study underway that's got some big dreams connected to it. And 20 years ago, I don't think anybody would have dared
think about that.
Those. No.
But that set the trajectory. And so here we go.
Yeah.
Well, thank you very much for visiting with us today. It's been really great to learn more about the history of Feeding South Dakota here in Pierre. I have a question for you before you go.
Sure.
If South Dakota were a fruit or a vegetable, what would it be and why?
Wow. I don't know that my brain really works in that way.
What about a dental tool? Not any easier.
Well, I think if it was a dental tool, I'd have to go with toothbrush.
Okay.
Because a huge part of good oral health and overall health is self-care.
Mm.
And so there's only so much that going to the dentist once or twice a year or having the hygienist clean your teeth are going to do for you. You have to take care of yourself. And I think South Dakotans have a long history of working hard to take care of themselves and their own. But that doesn't always work for everyone.
Sure.
There are going to be circumstances where someone has illnesses or disabilities or burdens that the rest of us can't imagine. And when that happens, I think South Dakotans are also really good about stepping out and helping their neighbors with a hand up.
I think you did really well with that.
Well,
dental tools were definitely easier than fruit or vegetable.
They are for me. It's 47 years of working in that space.
Use what you know, right? It's okay to be different and go a different route.
Yeah.
Well, thank you again for joining us today as we visited with Scott Jones about the history of Feeding South Dakota in the Pierre community and how it has been servicing the central part of the state and supported by the community, and also the vision for what the future of Feeding South Dakota might look like. Don't forget to join us next week for our next conversation on 50 Faces of Feeding South Dakota.